Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, this is the table showing the adrenaline, its route and concentration. Adrenaline in bronchial asthma, we use it in inhalational. Adrenaline is given in the concentration of 1:100, whereas anaphylactic shock, adrenaline is given in intramuscular route at the concentration of 1 in 1000. Adrenaline is given subcutaneous route at the concentration of 1 in 1000. Adrenaline is given intravenous route at the concentration of 1 in 10,000. Then cardiac and shock. In cardiac shock, adrenaline is given as IV, has 1 in 1000. With local anesthetics, adrenaline is given in subcutaneous route, has 1 in 2 lakhs. Thank you for watching.
Thank you and thank you for watching.